Great, thank you very much, Martin. Can I just check you can see my first slide?
Yes.
Thank goodness for that. I'm one of these people who kind of is the Chief Executive of Scotland's National Innovation Centre for Digital Health and Care, and any time I touch technology, it usually doesn't work. So here's hoping it works for the rest of the presentation. Thanks very much indeed, Martin, for inviting me to present today. The DHI, which is our National Innovation Centre, is funded by Scottish Government, and effectively we are here to support the use of digital tools and services to address the societal challenges being experienced by the citizens across Scotland, and to use digital products safely, effectively, but most importantly, appropriately. Just because you can do something using a digital product doesn't necessarily mean you should, and therefore a healthy dose of common sense is never a bad thing. Our key challenge, therefore, is to help Scotland's population live longer, healthier lives at home or in a homely setting, but at the same time create economic growth for Scotland and for the UK. That's both in terms of creating opportunities for Scottish companies to build digital products which they can service the needs of Scotland's citizens, but then sell those products globally, but equally importantly, to build collaborations to work together for a better future. And we do that looking at three things. Everybody thinks that all of us on this meeting today do technical innovation, and we do technology innovation. But when you're talking about health and care, equally importantly is service innovation and commercial innovation. What are the business models that will allow you to not only develop a social solution, but adopt it and allow it to scale? And my organisation takes those three legs of the stool and focuses on each with equal importance. So I'd like to share a little bit of my world, and then in the second half of my presentation is actually showcase how we in Scotland are going to be collaborating with colleagues in HSE to take forward what we're labelling next generation service development. This is our world. Technology is ubiquitous in our day-to-day life, but the reality is that we step backwards 5 or 10 years when we use technology in the delivery of health and care services. So just hold that thought for a minute or two. But I'd like to share another challenge with us. Some of you may have seen the inside of this pie chart before. This is the social determinants of health. We know that healthcare, which is in blue in the inner circle of that pie chart, contributes to yours and my health and well-being to the tune of about 20%. 30% of our well-being is made up by our individual behaviour, our smoking or drinking, our lack or otherwise of exercise, 10% by our physical environment, damp home, etc. But 40% is about social, economic and environmental issues. What we also know in DHI is that we then map the data points that we can collect about you as an individual and map them against those social determinants. And what it shows is that in Ireland, as in Scotland or anywhere else in Europe, for example, we are making life and death decisions about you, me, and our families based on about 16% of the available data, because the healthcare system only trusts the data it generates itself. And even then, hospital clinicians often don't trust the data that's generated by their family doctor counterparts, and vice versa. Whereas if you look around the other parts of the outside of the pie chart, we can collect data points that give a better picture of the lived experience of you and I as individuals. And as you know, the more information that we have about you, the better informed our decisions are going to be. So So that was 2 slides that I tend to use in all presentations, and was doing that up until the beginning of this year. And then along came coronavirus, and it's changed our life forever. It certainly changed the way that I rate presentations, and this is the way that I do it now. I use the Fauci scale. As you will see on level 5 of the Fauci scale, that was a picture taken of him when President Trump suggested that we should all ingest bleach as the way of getting rid of coronavirus. So it's all pervasive, the dreaded pandemic. But what are the key messages that we can take out of it? There's a lot of positives, but there's also a few negatives. This is the Queen Elizabeth II hospital in Glasgow, one of the most modern hospitals in Europe. And I'm showing this slide because, sadly, a lot of the conversations about the management of the global pandemic has been about buildings. It's been about hospitals. It's been about beds. It's been about intensive care capacity. And even when we started to talk about the most vulnerable in society, we weren't talking about individuals all the time. We were talking about care homes. Again, we were talking about institutions and functions. And for the next 3 to 4 months, we'll be talking about vaccination and processes. Whereas the reality is, we need to talk more about people. But some of the positives are the phrase that your politicians and my politicians and politicians around the globe are all mentioning is we're following the science. But to follow the science, you need to get the facts. You need to understand the data, and data is becoming ever more important. And because data is important, people are beginning to think digital. So for us, there are great opportunities for the future. But the one thing that really irritates me, and I don't know if it irritates you too, is that when people say we're really adopting digital solutions, and yes, we are, but the most successful technologies that we're deploying anywhere in Europe or the developed world has been in support of remote consultations, either using the telephone, which has been around for almost 200 years, or video consultations, which have been around for 16 to 20 years. So effectively, our innovations that we're deploying are taking as long today as it took for us to deploy penicillin all those years ago, when it took a world war to take that antibiotic into business as usual practice. And today it's taken a global pandemic for us to adopt video. So we haven't got it sorted. And that's why this community really cannot take their foot off the pedal. We need to continue to move forward and bring colleagues with us and challenge them to think differently. Because the one thing the global pandemic has demonstrated to me is top-down doesn't work. The government can make recommendations about behaviour. The government can even legislate to try to get us to change our behaviour. But as you know, the prevalence of coronavirus in our communities is down to the individual behaviour of individual citizens. And what's interesting is the one technology that can actually influence individuals and their behaviours are digital technologies, the all-pervasive, ubiquitous technologies I mentioned a little while ago. The other thing that COVID has done for us is it has meant that our health and care service delivery is not sustainable in the short term, let alone the medium and long term. So we need to do things differently. And the last challenge for us, which we've forgotten for the last year, is our need to move to a zero carbon society, because climate change is going to cause a greater public health emergency to the globe than coronavirus has or ever will do. And healthcare contributes between 6% in Scotland and Ireland, or up to 10% in the US, towards global CO2 productions. So things that can reduce travel, things that can influence the supply chain, things that can transform the way we deliver health and care services are the way to do things. So as Martin said at the start, shifting left is the way that you're driving things forward. In Scotland, we are doing exactly the same. We need to move away from investment in treatment and post-event care into prevention, detection, and promoting independent living. How do we keep people productive and active members of their own communities? Because it's all about the citizen. And that's where next generation services come in. And that's where we have to have an enabling environment that allows us to move into this brave new world where we all know we need to get to. So what we did in Scotland is we went to some of the most advanced countries and regions and looked to see what they were doing. So we went to Estonia, we went to Finland, we went to Singapore, we went to Canada, some of the US big healthcare systems. And rather than say to the Finns or the Estonians, can we buy what you've got? We asked their enterprise architects, knowing what you know now and knowing what technology is available, what would you do different? And what we did in Scotland is we built that. In DHI, we built that and we linked it to Industry 4.0 Toolkit. So this shows the different industrial revolutions. I'm sure you're all aware of them. And we are getting increasingly comfortable with talking about Health 4.0. But Health 4.0 is about two things. Precision medicine, very important, increasingly important as things move forward. But we've been lulled into the false sense of security that it's all about clinical optimization. It's about looking at the hospital as a factory and making the processes, the production lines, our clinical pathways more efficient. That only gets you so far. The real win, we believe, is looking at Care 4.0. It's about empowering our citizens to make better health and well-being choices. It's about empowering and enabling co-managed care. It's about making care accessible to people on their own terms through personalization. And it's about making sure that any services we offer are flexible and recognize the complexity of our individual lives. And appropriate service design using digital tools and services that consumer technology have recognized for a number of years can actually unlock that for us in the provision of health and care. So what have we said in the future? Rather than continuing to worry about simply linking up back-end databases, which we do need to do, but what if the citizen became the point of data integration? What if we stopped investing millions of euros in giving artificial intelligence to healthcare organizations or government departments or large companies, but actually gave artificial intelligence to the citizen to allow them to make better health and well-being choices? Wouldn't that be better? So we've built this environment. It's called our DSE. It is a consumer-based data exchange layer linked to a personal data store, which allows data to flow seamlessly from consumer devices, from formal health and care systems, through into the electronic health records or the GP records, and vice versa through the data exchange back to the citizen. We've linked healthcare systems to it, like blood pressure management, falls detection, but it's also linked to Apple HealthKit and to Google Fit. So any app that links to either of those platforms, that data can come and sit in the data exchange. And if the data is trusted, it can flow into the healthcare system and be blended with citizen-generated data. We've linked that with an immersive demonstration and simulation environment where we can bring policymakers, senior clinicians and others and expose them to the art of the possible. We can allow companies to plug their products in to the exchange layer environment, to allow them to get access in a protected and safe way to back-end databases, and to allow them to test, evaluate, and continue to innovate their solutions to make sure they'll work with the data within the healthcare system, and to allow us to make products that are not only relevant, but actually we can de-risk procurement when we move into a formal procurement phase. So the demonstration and simulation environment is a product that can be used to de-risk procurement, can stimulate innovation. We can run simulated data, we can run real data, and we can build new services, taking the best in class components and putting them together, from a blood pressure device through to the best clinical dashboard and visualization technologies, through to the best AI, rather than simply having to go to one company to purchase a state-of-the-art blood pressure device, but a pretty mediocre clinical dashboard. So it is a new way of looking at the world. It's a new way of operating. It's a new innovation that we're using in Scotland. We've built all our COVID track and trace solutions on that architecture. And it's an environment that we are sharing and going to work in collaboration with the HSE to look at next generation services to serve all of our citizens well. Thanks very much for your time.
Great, George. Thank you very much. And we're very much looking forward to receiving the demonstration simulation environment. We think it'll be, we met with your team earlier this week, and we're initially going to partner with your instance, but we hopefully by the end of Q1 we'll have an instance up and running in Dublin.